Welcome back to another Score Builders question and answer video session. This video provides members of the Score Builders team with the opportunity to explore challenging multiple choice examination questions with students actively preparing for the licensing examination. My name is Scott Giles, and I will be your host for today's journey. I will read the question and provide you with an additional 60 seconds to answer the question. Ready? Let's go. A physical therapist positions a patient supine in preparation for goniometric measurements. When measuring lateral rotation of the shoulder, where should the stationary arm of the goniometer be aligned? Option 1, on the lateral midline of the humerus using the lateral epicondyle as a reference. Option 2, perpendicular to the floor. Option 3, along the midaxillary line of the thorax. Option 4, over the olecranon process. Goniometry. Goniometry is a process of measuring angles, specifically the range of motion in the joints of the body. It involves using a device called the goniometer to determine the degree of movement at a joint in various planes. According to the American Academy of Orthopedic Surgeons, normal shoulder lateral rotation is 0 to 90 degrees. Remember, the question is specifically asking where the therapist should position the stationary arm of the goniometer when measuring shoulder lateral rotation. Let's explore each of the options. Option 1, on the lateral midline of the humerus using the lateral epicondyle as a reference. The lateral midline of the humerus using the lateral epicondyle as a reference should be used to align the movable arm of the goniometer when measuring shoulder flexion and extension. Option 2, perpendicular to the floor. The stationary arm of the goniometer should be aligned parallel or perpendicular to the floor when measuring lateral rotation of the shoulder. Boom. Option 3, along the midaxillary line of the thorax. The midaxillary line of the thorax should be used to align the stationary arm of the goniometer when measuring shoulder flexion and extension. Option 4, over the olecranon process. The fulcrum of the goniometer should be aligned over the olecranon process when measuring lateral rotation of the shoulder. The movable arm of the goniometer should be aligned with the ulna using the olecranon and ulnar styloid as a reference. The correct answer is option 2. Let's explore the all-student data. 9% of students selected option 1 on the lateral midline of the humerus using the lateral epicondyle as a reference. 62% of students selected option 2, perpendicular to the floor, the correct response. 12% of students selected option 3, along the midaxillary line of the thorax. 17% of students selected option 4, over the olecranon process. System classification. This question is a musculoskeletal systems question which represents approximately 27% of all exam items. Content outline classification. This question is a physical therapy examination question which represents approximately 24% of all exam items. Level classification. This question is a level 1 question since the question requires students to possess basic foundational academic knowledge. Remediation of level 1 questions occurs through academic review of entry-level content using textbooks, review books, Basecamp, and flashcards. Academic focus area. Looking to review related academic content? Check out pages 95 through 96 in PT Exam the Complete Study Guide. Thanks for joining us on the Score Builders question and answer video session. See you next week.